I'm oral historian Mike Chappell. Today, May 28, 2013, we're at the Endocrine Society's headquarters in Chevy Chase, Maryland, where I'll be interviewing Scott Hunt, Executive Director and Chief Executive Officer of the Endocrine Society. What do you think the future of the Endocrine Society might be?
Well, I think it's a bright future. I think it's an exciting time for the society now, an exciting place to be. We're right now, as we speak, upgrading the complete infrastructure of the society. So we've got a brand new vehicle underneath us, or will have within the next couple of months, and this will help all of our transactions. We do 100,000 transactions or so during the course of a year. This will equip us so that we don't look clunky, that we look more like Amazon than we do now. So getting a good feel for changing the society's infrastructure. That's important. I think that's very exciting. It equips us to be able to go to the next set of activities for the society, the next set of operations and programs. We need that basis. Part of it will be a new database that allows us to collect even more useful information on our members about what they do, what they need, and it will also let us collect more information about other people who are going to be using our information, our content, in the future. And the database and all of that infrastructure needs to be in place. So that's all very exciting. Physically, we're going to move. We're sitting here in Chevy Chase, Maryland, but 7-8 months from now, we will be at the corner of 21st and L Street in Washington, D.C., in the row with the other societies that look like us, the major medical societies in this country. And that's very exciting. So we're physically positioning ourselves in the right area of town, in Washington, where the advocacy is done, where the professionals that do the same work that we do all go to work in the morning. So that's very exciting. For the society and its programs, lots of good things on the program right now, or in the plans right now. We are launching Endocrine Press, which is going to be a tremendous expansion of the distribution vehicles for the content of the society. I would have said it's books. Press sort of implies books, but books are only one of the vehicles that we'll be using. A lot of it will be electronic. A lot of it will be presented material, or material that's presented in one place, transferred into a different format in others. Endocrine Press will be the house for all of that, and that's a tremendously very big initiative for the society, and a very exciting one for the society. And that Endocrine Press will meet the needs of all of our constituents. It'll meet the needs of the basic scientists, the clinical scientist, and the clinical practitioner. There'll be something for each of those groups within Endocrine Press, and I think that's dynamite that we've got that sort of potential coming on board within the next few months. So that's a big deal. I think it's kind of fun, and we are rebranding the Endocrine Society. Probably soon after you see this video, we will have a new logo, maybe a new tagline. The visual symbol of the Endocrine Society will be changed. It'll reflect our potential, it'll reflect excitement, and it will reflect growth, and hopefully our youth for the next 100 years of the society's operation. So that's kind of fun. I think there are some other opportunities that present themselves to the Endocrine Society, and I think we'll be taking good advantage of those. Let me give you an example. Right now, about 90% of the endocrinology in this country is done not by endocrinologists, but by primary care docs. And they're seeing patients with diabetes, they're seeing thyroid patients, they're seeing women in menopause or women with hormonal imbalances and so on. It's primary care doctors and associated allied health professionals, maybe nurse practitioners as well, who are seeing patients with endocrine disorders. And we have the content. The Endocrine Society has the content in endocrinology, and yet we're not seeing those patients. We can never, there will never be enough endocrinologists to see all of the patients in this country that have endocrine disorders, but we can provide the content that would be useful for primary care and for other health professionals who are seeing patients with endocrine disorders. But as I said earlier, our content is in Greek, and they want it in English, and they want it in a physical format that they can use easily, that they can use in an encounter with a patient, that they can use at their leisure. Those are different requirements that they can use in the right technological format. Is it on a iPad type device, or is it in a handheld device? It's got to be right for each of these groups. So our challenge is to take our superb content, the best content in the world in endocrinology, and put it in a format so that it helps those people who are actually seeing the patients with endocrine disease. Think about the multiplier. I mean, there are probably 250,000 to 300,000 primary care physicians in this country. There are, in a stretch, maybe 10,000 endocrinologists. So the multiplier of our content is potentially fabulous. So we'll increase our impact and influence, back to the strategic plan again. That's an important change there. And we will get more eyes on the work of our members. So a given member who writes a paper for JCEM will now see may see a version of that that's written for primary care, that provides the essence that the primary care doc needs to have when he's seeing a patient. And as a business guy, I would also say there's a business model for this, because when you have that kind of an effect, that kind of potential distribution, you know, even if we got 10% of that market, that would be 30,000 deliveries of content. There are people, docs, pharma, others, who are willing to pay to help get that information distributed. So there should be a remuneration that helps us pay for the translation, that puts the content from Greek into English and into the right format. I see this as a tremendous opportunity to expand the influence of the Endocrine Society, get the content of our members into the right hands so that it can improve patient care. I think it's almost, it's a beautiful model, and but it's not an easy model for us, because our docs don't usually think in terms of a content that will be useful for these audiences. So staff has to make the bridge. We have to find the writers who can take the content, put it into the right format, put it at the right level. That's our job. Our docs do the content. We'll take care of the translation, if you will. But I think that part of the future for the Endocrine Society, is fantastic, a great opportunity. So I'm very optimistic about where we can be in the world. I think that we have all the pieces in place to be able to do this. We've got the infrastructure coming online. We're physically going to be where we are downtown, can attract the best talent, and I think that we have the content. So it's a matter of getting the content into as many places as it possibly can.